Hello everyone, welcome to the Circular Vision podcast, the podcast series where we talk about the new opportunities circular DNA creates in early diagnosis and monitoring of disease such as cancer and inflammatory bowel disease, IBD. Circular Vision is a European Horizon 2020 FIET open project by fostering novel ideas and is coordinated by principal investigator Brigitte Regenberg, who is associate professor at the University of Copenhagen. I'm Sonia Diaz, and in today's episode, I'm joined by Estrid Høgdall. Estrid Høgdall is a clinical professor in molecular pathology at University of Copenhagen and head of molecular unit, Department of Pathology at Herlev Hospital. Furthermore, she's also director of the National Biobank in Denmark, covering regional cross-national infrastructure for biobanking. In this episode, we will be talking about Danish biobanks, and we will know, among other interesting topics, why Denmark is unique in this field, why it's so important the biobanks for researchers, the future of the biobanking industry, and what is currently the most exciting things happening in the genomics area. We will also know the steps to follow to ensure patient confidentiality. So let's start our conversation asking Estrid Høgdall, what is the Danish Biobank and how does it contribute to medical research in Denmark?
The Bio and Genome Bank compose of a lot of clinical biobanks, meaning that samples are collected for diagnostic use for the patient's own diagnosis and treatment, but they should also be optimal for any research studies going on aiming benefit for future patients. And therefore the Bio and Genome Bank compose of several clinical biobanks in addition with research biobanks, and they are all facilitating whole Denmark.
And now when you are just explaining about Denmark, why Denmark, here this Nordic country, is so unique in this field?
It's unique, the Bio and Genome Bank Denmark, because it's well implemented through all hospitals in Denmark, taking blood samples and tissue samples. It's also unique because we have corresponding samples, both tissue and blood samples, and it's mandatory to do it for patients arriving at the hospitals. Those investments from our government will in the future make a big difference for biomarker research, and the biomarker research should end up with biomarkers with targeted treatment, aiming that precision medicine can be completely implemented in our diagnostic and routine.
You just have mentioned this personalized precision medicine. Then I think understand that is why the importance of the biobanks for researchers and clinicians, and also is how this biobank can help especially in the cancer research. For example, if it can be a biomarker, I think there is these three deadly cancers that they are diagnosed in a state that is very late: the ovarian, lung, and pancreatic cancer. Is this correct? So these biobanks can help in this cancer research for this specifically this type of cancer?
We have a lot of biobank samples from all three categories of cancer diseases. Overall, it's characterized by that patients are arriving at the hospital and getting diagnosed in the late stages of disease. So they are very sick. So if we can find biomarkers being able to select high-risk patients to have faster referral, or even hopefully we could find a biomarker so we could prevent the disease, then it will really help, because the patients are having a bad prognosis because they are diagnosed very late in treatment course.
Okay, and it will be any type of cancer?
It would be any type of cancer, but especially those three you just mentioned, they are characterized by being late stage and having a severe disease, and they may be difficult to do surgery on because it's spread. So therefore, like we know, radical surgery is almost the best way of treatment, but it may not be possible if you are in late stages of disease. So therefore, if we can find biomarkers being characteristic so they can be found before they are in late stage as an early localized disease, then it might help with prognosis.
Now, more specifically in our research projects, this EU project, as I have mentioned, is to try to find out a biomarker for early diagnosis of pancreatic lung cancer. Julia Sidenius-Johansens, the professor Julia Sidenius-Johansens is one of the beneficiaries. What is your collaboration with Professor Julia Sidenius-Johansen? I think it's also from Herlev Hospital here in Denmark for our EU project Circular Vision.
I have been working with Julia for many years. Actually, since I graduated, I have been working with Julia because she is really a very well-known person with biomarker research, especially within cancer diseases. Especially connected with this study, I got a phone call from Julia. She was really astonished and didn't know what to do. She had a collaboration agreement regarding tissue samples to be analyzed in this really important study. And some of the agreements she had was not working out in the way, so she couldn't deliver any tissue for the study, thereby influencing the performance of the study and the work through, and also indicating a delay in the study being performed. So she called with the red phone and said, SOS, may Danish Cancer Biobank, Bio and Genome Bank Denmark help me? And from the very beginning we told her, we can have an overview to see how we can do, but we had to have all legal assured before you can have any tissue out for the study. So we did a search, and we within a week could tell her that we were able to deliver high quality material for the studies, but she had to have legal approval. She got that one, and within a very short time we had delivered the tissue material to be included in this study. So by this, actually, Bio and Genome Bank Denmark and Cancer Biobank did a big difference, because without the tissue there would be no study, and without the study there will be no new knowledge. And in the very end, if the knowledge is a good finding or a good marker, then no benefit for the patient would be there. So actually I think the Bio and Genome Bank helped to go through with this very important research.
Okay, and now just talking a bit about this EU project here in Europe and the biobanks in general. Is currently any collaboration ongoing with other biobanks in Europe, and if not, why? And what it will be, for example, I don't know, the advantage of a European biobank? What do you think?
Well, we have a strong collaboration both in Denmark, across Denmark, because there are different biobanks. We also have it in the Nordic country. We have a scientific collaboration as well. And regarding the research studies, we have several collaborations with people in Europe or outside Europe as well. So it's a matter of, like, research studies also are going on in collaboration, and we have really those high quality material, and we can connect it with the clinical information for the patients, because still having the tissue or blood, like biospecimens, you can use it for something, but if you add on clinical information, you can use it for a lot more, making a big difference for future patients.
Okay, and how do you see the future of the biobanks in the world and in Europe, for example, in the next 5 years?
Well, I think it will be growing, and we can see it already. Like, we did start with one biobank, the Danish Cancer Biobank, but by the end of this year we will have 11 fully implemented nationwide biobanks covering different areas of patients, persons. And I think it will be growing, because with the omics and genetic analysis, it is mandatory, because then it will not be a lot of patients having the same disorder, then it will be few patients. So it's really important to be able to pick up the right cohort for doing the testing improving that we can validate the biomarker for use in clinical setting. So it's mandatory to have the best sample and the right sample.
Okay, and now I want to also to talk about a subject that I think is also quite important, is the informed consent and the participant and understanding about why I'm going to participate in these biobanks and how much I'm protected. Because biobanks, what I understand, is help to better understanding the genetic basis of diseases by linking the DNA blood samples to medical information. But the broad scope of such research projects, for example in cancer, present a huge challenge to informed consent and participant understanding. What steps do you take to ensure patient confidentiality of samples that they are in use? And how is the Danish Biobank able to provide these information to researchers, but at the same time you have to ensure patients' privacy is protected?
Yeah. It's a big question, and the patients, they have information regarding the Bio and Genome Bank Denmark when they are included in the biobank. They are giving consent so they know that we store the biospecimens in the biobank. Every patient has the possibility to make registration in one registry where they can say, I don't want my samples being used for research. Every time we are giving out biospecimens, we are looking up in this registry to control that they are not saying no for research. Then we also have ethical committee and we have data protection, so all those ways of making the regulation correct is performed before we can do any studies. And of course, if it's very seldom, it should be pseudo-anonymized or anonymized in the way so no patient can look at a research study and say, oh, it's me. So if we have few events, then it should be categorized like a group of less than 5 or less than 10. So it's not showing up who it is.
In your opinion, what is currently the most exciting things happening in the genomic area right now?
In the genomic area, I think it's really important to see how unique targeted treatment may change the way of treating patients, like based on the event, genomic disorder, genomic change, that you can target the specific change and then make like chronic disease or delaying a relapse. So I think we will see a lot of developments within this area. So it will be like one cancer patient will never be the same as the next cancer patient. There will be differences all over, but that's precision medicine in the whole setting.
And just to finalize, how many people's DNA samples has the Denmark Biobank?
Yeah, I think also one of the very important things is like we in the future may, due to our studies, see some changes which we don't have any targeted treatments for now, but we may indicate that it could be relevant to develop a medication directed on a biomarker target. In the Bio and Genome Bank Denmark, I just looked it up because I had some thoughts about you may ask about it, but we have more than 260,000 persons, unique persons included in the biobank. But if you go for materials taken at a time point, then we have much more, because our aim is also to covering the full course of the disease. So it could be at diagnosis, but it could also be at follow-up and doing treatment. We have samples. So it's a huge collection of biospecimens we have.
Okay. There is something that you want to highlight or just to say?
I hope all future clinicians, all future researchers will be aware of that there might be possibility for use of biobank and the sources and the good quality in combination with the clinical data.
Thanks, Estrid, for setting aside some time to be our guest on the Circular Vision podcast. We are also excited to share that Estrid Høgdall will be one of the 3 members who will join our scientific advisory board. She will be invited to attend the 6-month consortium meetings and engage in our scientific talks, review our results, and also provide advice, suggestions, and insights from her field of activity. The next consortium meeting will be held in San Sebastián, Spain, at the Instituto de Investigación Sanitaria Biodonostia on the 6th and 7th of October this year. So that's all for today. Stay tuned for our next episode. Thank you and have a nice day.